Alpha-1 antitrypsin (AAT) deficiency. What is AAT deficiency? Alpha-1 antitrypsin inadequacy is a hereditary sickness, which implies it's passed down to you from your folks. It can cause genuine lung or liver infection. You may likewise hear it called AAT lack. Indications regularly incorporate difficulty breathing and embittered, or yellow, skin. There's no fix, yet medicines can assist you with dealing with your liver and breathing issues. You get the sickness on the grounds that your liver doesn't make a sufficient protein called alpha-1 antitrypsin, or AAT. You need AAT to secure your lungs. Without it, diseases and different aggravations, similar to tobacco smoke, separate pieces of your lung significantly quicker. In the event that you have AAT lack, you probably won't have breathing side effects until you're in your 20s or 30s. At the point when they start, you could feel shy of breath or wheeze when you inhale, much the same as somebody who has asthma. For certain individuals, AAT insufficiency can cause interminable obstructive pneumonic obstructive infection (COPD). At the point when you have COPD, you frequently have manifestations of emphysema, a genuine condition that makes it difficult for you to let some circulation into your lungs. COPD can make you hack up bodily fluid, raise you wheeze or have hell breathing, and cause your chest to feel tight. You additionally may have constant bronchitis, an aggravation of your aviation routes that makes you hack a great deal and messes breathing up. You'll most likely need to take medication through an inhaler that you heft around, similar to the sort that individuals with asthma use. This is something you'll have to wrap up of your life. Remember that no two instances of AAT insufficiency are similar. Not every person gets extreme side effects. With treatment, you'll likely, despite everything, have the option to work out, and appreciate a considerable lot of your preferred interests. Connect with a friend network and family, and get some information about care groups. It can assist with conversing with individuals who comprehend what you're experiencing. Symptoms of AAT deficiency. You probably won't realize you have the illness until you're a grown-up. A great many people get it between the ages of 20 and 40. You may feel shy of breath, particularly when you attempt to work out. You likewise could begin to wheeze or have a whistling sound when you relax. You may likewise get a great deal of lung contaminations. Other admonition signs include feeling tired. Your heart thumps quick when you hold up. Weight reduction. On the off chance that AAT lack causes issues with your liver, you could have side effects like yellowish skin or eyes, swollen tummy or legs, hacking up blood. An infant may have jaundice, a yellow tint to the skin or eyes, yellow pee, inconvenience putting on weight, a developed liver, seeping from the nose or umbilical stump. It's uncommon, however a few people likewise get a skin ailment called panniculitis. It causes solidifying of the skin alongside difficult knots or fixes. Causes of AAT deficiency. Alpha-1 antitrypsin inadequacy runs in families. In the event that you have it, you got it from defective qualities that both your folks went down to you. A few people get the qualities however don't have any indications. Or on the other hand, they have a gentle rendition of the infection. The messed up qualities you get from your folks cause you to have a low degree of AAT protein in your blood. It can develop in the liver as opposed to going into your circulatory system. That development in your liver causes liver illness. The deficiency of AAT protein in your circulation system prompts lung infection. Tests for AAT deficiency. Your primary care physician may ask you inquiries, for example, do you feel shy of breath? Have you been getting a great deal of colds or lung diseases? Have you shed pounds of late? Have you seen any yellowing of your skin or eyes? Your primary care physician will likewise tune in to your breathing with a stethoscope to check for wheezing or different signs that your lungs aren't working right. You have to get blood tests to affirm your determination. These tests verify whether you have the messed up qualities that cause AAT lack. They additionally hope to perceive the amount of the protein you have in your circulation system. Your primary care physician will likewise test your lungs and liver to perceive how much harm the condition has caused. For instance, a chest X-beam may give indications of emphysema. A unique blood test checks the oxygen level in your supply routes, an indication of how well your lungs work. You may inhale into a cylinder to perceive how much air you're getting into your lungs. Another blood test checks for issues with your liver. You may likewise get a liver biopsy. For this test, your primary care physician utilizes a flimsy needle to take a few cells from your liver and check them for indications of harm. AAT deficiency treatment. In spite of the fact that there's no remedy for AAT inadequacy, you can raise the measure of AAT protein in your blood, which secures you against more lung harm. Specialists call this enlargement treatment. You may likewise have this treatment on the off chance that you get emphysema. Enlargement treatment is likewise called substitution treatment. You get another gracefully of AAT protein that originates from the blood of solid human contributors. You get the treatment once every week. The substitution alpha-1 gets into your body through an IV. You can have this done at home with the assistance of an expert, or you can go to a specialist's office. The objective of growth treatment is to slow or stop the harm in your lungs. It won't opposite the sickness or mend any harm you as of now have. You'll require these medications for an amazing remainder. Contingent upon how you're doing, you additionally may get medicine that you inhale into your lungs with an inhaler. Specialists call this a bronchodilator, implying that it opens your aviation routes. On the off chance that your breathing difficulty prompts low degrees of oxygen in your blood, you may need to get additional oxygen through a cover or nosepiece. Your PCP will likewise give you a referral for pneumonic recovery to assist you with breathing better. Taking care of yourself. Great propensities are critical to assist you with remaining solid with this condition. You shouldn't smoke, and you have to get a pneumonia antibody and your yearly influenza shot. Converse with your PCP about how to practice securely, which reinforces your lungs. Great nourishment can assist you with keeping your liver solid. Stay away from residue and smoke, and wash your hands regularly to forestall contamination. Breaking point the liquor you drink to secure your liver. Children with AAT insufficiency may require an extraordinary milk equation or additional nutrients. It's additionally significant for them to have normal clinical exams to monitor how well their lungs and liver are working. Backing from your friends and family, and from other people who have a similar condition, likewise has a major effect, so you know there are individuals who comprehend what you're experiencing. Questions for your doctor. Ask your primary care physician any inquiry you have about this condition. You may begin with these. Have you rewarded others with AAT insufficiency? How might I ensure my lungs and liver? What treatment do you recommend? By what method will we realize how I'm doing? Would it be a good idea for me to get my youngsters tried for this condition? What to expect? AAT inadequacy is distinctive for everybody. A few people have extreme issues. Others may have not many or no manifestations. In infants and kids, the condition is bound to cause liver harm than lung issues. In any case, just about 10% of youngsters with it have serious liver infection. Youngsters with AAT inadequacy additionally may have asthma. You'll be increasingly delicate to smoke and residue. Indeed, even the basic virus can prompt breathing issues. About 30% to 40% of individuals with this condition will have liver issues eventually in their lives. Seeing whether you have AAT insufficiency is the initial move toward the solid propensities and clinical medicines that help control the infection.